Hi, you're listening to the Baby Manual podcast, the podcast that helps you feel confident as a new parent. I'm your host, a pediatrician and mom, and the author of the Baby Manual, Dr. Carole Keim. Hello, and welcome to the Baby Manual podcast. This is episode 16, 12 months or 1 year of age. First of all, parents, I want to just congratulate you on making it through the first year. This was probably the hardest year of your life, and think about how much your baby has grown and developed, and you also have grown and developed as a person, so congratulations. For your baby's development, you should be engaging with them often by speaking with them, and a lot of times babies at this age will be repeating back sounds. And so you can teach them all kinds of things at this age. You can name objects that you see. You can point at things that are interesting and tell them about them. And babies just love that. They're soaking up so much at this age. And even though they're typically not talking a lot, usually they're just saying like mama, dada, and one other word like hi. They are understanding so much more than that. So just keep talking to them all of the time. Babies should be able to move away from you for a few moments, like walk away or crawl away from you, but they will check back often to look at you. Make sure you have a yes space for them. So an area of the house where they can be safe to play with whatever is in there. So that means no choking hazards and no outlets or covered outlets or nothing that they can pull down onto themselves. You might want to start anchoring furniture into the walls because babies like to climb up on furniture. And even things like dressers, which look really nice and heavy and stable, if they pull the drawers out and then climb on them, those can tip over onto them and can crush them. So it's a good time to get furniture anchors going if you haven't yet. You should be having regular date nights if possible with your partner and hanging out with your friends and making time for yourself. And most parents at this age are comfortable leaving their baby with a babysitter. So I do highly recommend that so that you get a little bit of time to yourself and get to recharge a bit. Be sure to use constant and consistent positive discipline. So that's things like noticing and commenting on the good behavior you see. Like, oh, you got this toy for me. Oh, you put that away. They love doing things to help out at this age. Babies love throwing things into the trash. They love wiping up spills. They love to just be helpful. So anything that you notice that they do that's helpful, just comment on it. Like, I see that you did that. You don't have to throw in a word like good job or put any sort of judgment on it like that. You don't just say, oh, it's good that you did that. Just say, I see that you did that. And that's plenty for them. And they get really excited to keep doing that then. Try not to use the word no as much as possible. So instead of saying no, tell them what they can do instead. Instead of saying things like stop running or no, don't eat that, you can say things like walk, please, or put this in your mouth instead, or here, give me that. Let me give you something else. So you can use distraction and substitution to help them out at this age to learn what's okay and what's not. And you'll find a lot of babies at this age, they seem to go for the more dangerous things. And it's mostly because they just haven't experienced those things yet. So they'll probably grab for scissors and knives and, things that they're not allowed to have just because they're like, oh, this is a new thing. I want to explore it. You might also notice that toys at this age, they have a lot less interest in those and more interest in household objects. So I'm not a huge fan of the expensive toys, especially electronic ones that make noises, because they usually only have one purpose. And as soon as baby figures out, oh, I push a button and it makes this noise, they're over it. So things like pots and pans, washcloths, keys, things like that are great to give to your baby. I would not be handing babies phones at this age. They'll try to eat it. They might drop it. And that's $1,000 piece of equipment that you're giving to a tiny baby. They don't need it. There are so many other things that can keep them entertained at this age. So try not to give them your phone. Try not to give them a tablet or show them a tablet yet. Even TVs and screen time, 15 minutes a day of screen time is more than enough at this age. And if they have too much screen time, babies get shorter and shorter attention spans. They get more frustrated more easily, and they don't sleep as well at night. So there's a lot of negative sides to giving them devices, and they do not need it to boost their development. The very best way to boost their development at this age is to talk to them, explain things to them, and play with them and just interact with them. Let them decide what they want to play with and then go along with it and play with them. Make sure you're giving your child regular downtime during the day. Usually between 9 months and a year or around a year is where babies will transition from 2 naps to 1 nap. So that can be an awkward transition. It usually takes a couple of weeks for them to fully transition, But make sure you're offering them that downtime at least twice during the day right now. And they might sleep for one of them and they might just play quietly for the other time. If you're doing downtime together, you could be reading them a book or sitting on the floor with them playing a quiet game. They don't usually scribble at this age, but it's okay to try to draw with them and, just show them how to hold a crayon. Usually they'll hold it with their whole hand, not like the mature pencil grasp with 3 fingers, but like a whole fist grasp. And a lot of babies will try to eat those crayons. So if you're letting them color, make sure you're doing it with them. But quiet time is really great at this age so that they can at least get used to that sort of downtime and recover a little bit. This is a good time to look for parent-toddler playgroups too. So if you know anyone that has kids around your child's age, or if you can look online for some parent-toddler groups in your area, most 1-year-olds are not really playing with other children. They're doing more parallel play. So they're playing on their own and there's another child nearby that they're playing with. But they do like to look at other children and smile with them and sometimes try to talk to them. But also don't expect a whole lot of interaction. That's normal at this age. And also, this is the age where as soon as one child is interested in a toy, everyone wants that toy. It doesn't matter what it is. They'll all try to grab it out of their hands and cry. And then, something else becomes the favorite toy of the group and everyone tries to grab that one. So totally expect that. You can talk with the other parents and ask them, how do you want to handle conflict right now? Do you want us to step in? Do you want to just let them figure it out on their own? Different parents will have different feelings about this. And so it's a good thing to establish also like on playgrounds and things, whether you want your child to work it out on their own or whether you need to step in. Of course, if a child is hurting another child, you do need to step in for that. For birthday party planning, if you haven't already had their birthday party, remember it's mostly for the parents. Also, if you get invited to a birthday party, make sure you give a gift to the parents, like a gift card or at least a card saying congratulations on making it through the first year. The babies at a birthday party, they typically get a little overwhelmed and they might need some downtime even during the party. I would expect them to be done within an hour or two and then allow some rest and recovery time after that. They can have cake for the first time at their birthday party. That is okay. And make sure that they've had all of the ingredients that are in cake before you give them cake and that they're not allergic to it. So eggs, flour or wheat, and butter or dairy are typically what are in cakes. And some kids will react to those things. So if your baby hasn't had any exposure to those things yet, just be a little bit more cautious with the cake. Or if they have an allergy, make sure you leave those out. After a year of age, a lot of babies will outgrow dairy, wheat, and egg allergies. But again, this is not the time to be testing that at their birthday party. So talk to your doctor if your baby's had an allergy to one of those 3 things. And you can talk about reintroducing it or re-challenging it later. At a year of age is where the parenting expectations really start to come to the surface. So you might notice that you and your partner don't agree on how you talk to the baby and how you discipline them or redirect them. Remember, you should not ever hit a baby, and yelling at them or screaming at them can be really damaging to them. So talk it through with your partner. If you are able to go to therapy together, that is a really great way to have a safe space to talk about things like expectations and ideal conditions and, things that you might not have thought about otherwise. And also just to make sure that you're both connected too. And I would highly recommend a Love and Logic class or a similar parenting class together. Both parents need to take the parenting class. It does no good if one parent takes it because then that parent becomes sort of the authority trying to parent the other parent and the baby at the same time. So take that parenting class together so you're both on the same page. Love and Logic is a really great one. It's all about empathy and understanding why your child is doing the things that they're doing, and then connecting with them to, in the end, eventually change their behavior. But it's not a behavior modification first. It's connect with your child, figure out why they're struggling. I like the expression, if your child is giving you a hard time, it means that they are having a hard time. So they're not trying to give you a hard time. They're just struggling with something. And Love and Logic is great for empathizing with children. So for development at 1 year of age, their stranger anxiety has typically gone away and they're a little bit more outgoing, but then it's going to come back again around 15 to 18 months. So for right now, they should be pretty social and able to approach, strangers, other family members, friends, things like that. They might have a preferred parent at this age, and that's pretty normal, and it's not going to be forever. So if your baby seems to favor one partner over the other, that is a normal phase that they're going through. And just remember that, you both still continue to shower your baby with love and affection and realize that, don't take it personally. They just will typically have a preferred parent. And it's okay if they don't too. Usually they're starting to talk at a year of age. So typically they're saying mama, dada, and one other word like hi or bye. They'll wave hi and bye at this age. They like to imitate sounds. A lot of them will do animal sounds at this age really well. And they start jabbering with inflections. So they might say like ba 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 ba, where it goes up and down like that. And even though it's not sensical, or you might hear a word thrown in here or there, it's that up and down cadence that we're looking for as if they're talking, even though there's not real words coming out. Also, when babies do find a word, that might become the word for everything. And it's just because that's the first thing they can think of when they're trying to express themselves. So they might call everything ba, for example, or whatever sound or word that they have chosen. And it doesn't mean that they're wrong, or that they're not learning. They are. They're just finding that first word first. And so you can tell them the names of things and let them try to copy you when you say the word, and say it a few times, say it slowly. And that's one great way to help boost their development. At 1 year, they're starting to point out objects. So they might point at things like airplanes in the sky, or fire trucks going past, or animals, or other babies. They love that stuff. So they might point things out to show you. So when they do that, just get excited and tell them what it is if they haven't said the word of it. And they'll usually bring you things to show you or to play with you. So they might bring you a book when they want to be read to, or they might bring you a toy that they want to play with. They play interactive games at this age, so they respond really well to peekaboo and patty cake at this age. And sometimes they'll try to do peekaboo back. But if they're not doing it back, that's still developmentally normal at this age. They can follow simple directions at 1 year. So things like put this away, or put this in the trash, or hand me that toy. So single one-step directions they can typically do at this age, and they love to be helpful. So I'd say take advantage of that. Let them wipe up spills, let them throw trash away. Yeah, they get really excited about that sort of thing. They also start walking typically around a year of age, but usually not very well. So normally they can stand on their own for a few seconds and then fall over, and then they'll cruise along furniture. So they can walk holding on to a coffee table or a couch, walk holding hands. Some babies are advanced and they start walking earlier than a year, and some babies start walking as late as 18 months, and that's still normal. So if your baby's not walking yet, it's okay. But also if they have delays in other areas, just make sure you're checking with your pediatrician that they're not having any global developmental delays. They can also identify people at this age upon request. So when you ask them, where's mom? Where's dad? They'll point at the right person, which is super cool. At 1 year is when we start weaning the pacifier and the bottle. So that's because of their teeth. When their teeth come in, we want them to come in nice and straight. To wean a pacifier, if you haven't yet, there's a couple of different ways. One way is only to give it to them when they really need it. Like if they need it to fall asleep, use it, but only give it to them when they're sleeping. Don't let them walk around with it in their mouth during the day. And with a bottle, one way you can wean a bottle is to start progressively watering down the milk or the formula. Now that they're over a year, they don't need breast milk or formula necessarily for nutrition. It's okay to keep breastfeeding. It's okay to use up the formula that you have, but you can also start watering it down. So start with like 3/4 milk and 1/4 water, and then half and half, and then 3/4 water, 1/4 milk, and then eventually all water. And then they should lose interest in that bottle after that. And you can also just switch to a cup or a water bottle at this age, like an adult type of water bottle. One other way to wean the pacifier, if the timing thing alone is not enough and they're still really dependent on it, is to snip off the tip of it. So you can start just by cutting a hole in the tip of it so that they can't get that full suction when they suck on it. And then maybe after a day or two, cut off a little more of the tip and then keep cutting it more and more off of it until eventually there's just a tiny bit of a nub left, and usually they've lost interest by then. If these tricks are not working, you can talk to your doctor for some more tips. For sleep at this age, they're usually sleeping 10 to 12 hours at night and taking one nap during the day. So remember that awkward transition when they're going from 2 naps to 1 nap. They will still get tired, and it can be hard to decide, do we let them take a nap late in the day, or do we just try to keep them up until bedtime? Sometimes you might need to move bedtime an hour earlier to compensate for that, and that's usually enough to help. They should have their bedtime routine fully established now. You should be brushing teeth together now. So you brush your teeth, you brush baby's teeth. And if your baby is struggling, I should be calling him a toddler now, right? If your toddler's struggling with you letting them brush their teeth, then you can let them brush your teeth first and then their own teeth. Or you can let them start on their teeth and then you can finish up. So there's a couple different options you can give them. But yeah, letting them brush your teeth is one thing that's usually really fun for them. And then it's like, oh, now it's my turn to do yours. And it's sort of that trade-off. And they like that a little bit more than just like, I'm going to brush my teeth and then I'm going to brush your teeth. Make sure you're reading to them at night, sing to them, have whatever kind of wind down routine you normally do. And ideally, they should be sleeping in their own room now in a crib. And you can consider moving them into a toddler bed as soon as it's okay for them to get up and out of bed. So as soon as they're walking well and they're able to safely get out of their bed and back into it and able to safely get to your room to wake you up if they need you, then that's the time to switch to a toddler bed. So usually it's around age 2 or 3 that we switch to toddler beds. But it is okay to do it earlier. And I know like Montessori style floor beds are also really nice where it's just a mattress on the floor and then they can get out of that safely and get back into it. It is okay to have blankets in the bed now that they're a year, but remember, no pillows until they turn 2 and no bottles in the bed. They should never have any bottles in the bed. And if they're wanting a bottle after brushing teeth at night, you can give them a bottle of water and that's okay to do. Or you can, if they're still really dependent on that milk, then do that progressive watering down, starting, with the 3/4, 1/2, 1/4, and then all water afterwards. For nutrition, they should be eating basically like an adult does at this age. So 3 meals and 2 or 3 snacks per day at the same time as the family. They should be sitting in their own high chair and you should allow them to feed themselves at this age. So usually at a year, you don't need to put the food into their mouth anymore. They can put it in themselves. Of course, they typically do love to smear it all over their face, all over the high chair, throw things on the floor. And that's just part of exploring food, but also it's okay to feed them if you don't want to have a mess like that. But do let them try to feed themselves as well. Make sure you're offering a big variety of foods. All of the food groups are okay now. It's okay to have honey now. And it's okay to have milk now, but most pediatricians still recommend not giving any cups of milk. And that's because milk does not have very many nutrients in it. It has calcium, fat, and protein, and you can find that in just about any other type of food. There's calcium in dark green veggies, and most kid foods are fortified with calcium. So you typically do not need milk. And then also, if you want them to be consuming dairy, things like yogurt and cheese are another way to get that in. Yeah, cups of milk are okay at a year, but I still don't recommend it. I recommend only water, but it's okay to keep breastfeeding too if you'd like to. And then, just finish up whatever formula you have on hand. It's not like you have to stop giving it at a year, but if you have a little extra, you can finish it out or you can donate it. You should be giving a cup for water at this age or a water bottle and not a baby bottle. So water bottles with straws and, that they suck on is a different kind of sucking motion than sucking on a baby bottle or a breast. And so we want them to develop their mouth and be able to suck that sort of mature suck. And water bottles are great for that, or just cups are awesome. And make sure they're eating greens every single day. They should have at least 1 or 2 servings of greens, ideally 3 to 5 servings of greens every day. And it's okay to have meat, red meat at this age. If you're a vegetarian, make sure they're eating lots of greens, and also beans have iron in them, and the greens have iron in them as well. And if they're not eating green foods or red meats very consistently, it's okay to supplement them with some vitamins. So you can do a chewable vitamin. Remember that gummy vitamins typically do not have iron in them. So check the vitamins that you're getting. Make sure that there's iron in them because your babies do need that to grow and to make blood cells. And then you can determine what you offer to your child and what time you offer that to your child. But try to allow them to decide how much they want to eat and if they want to eat. And it's okay if they don't want to. A lot of toddlers will graze. And, I see a big variety at a year of age. Some kids will eat more than their parents do at a sitting. And then maybe at the next meal, they'll eat 1 bite and say that they're done. So that can be a normal eating pattern at this age. So you just decide what you're offering and when you offer it, and then they're deciding how much. And if you're doing things like dessert, I suggest putting everything on the plate at the same time. So putting sweet foods and savory foods on the plate at the same time, and letting them choose what they want to eat in what order. And that's going to allow them to develop healthier eating habits later in life. Of course, you should always be offering at least a couple of healthy options during that meal. So at least some fresh fruits and vegetables and, your variety of food groups and not only sweets. But yeah, a lot of children will choose to eat the sweet things first, but then given the option, they will also eat the vegetables too. So brushing teeth, you're brushing twice a day now with fluoride-free toothpaste until they're able to spit. Once they're able to spit, it's okay to use fluoride toothpaste. And also, if you don't have fluoride in your water source, you can use a tiny bit of fluoride toothpaste, just the size of a grain of rice. And that's enough to get them their fluoride for the day. And then you should be scheduling their first dentist checkup now. Or if they don't have any teeth yet, then you can schedule it when their first tooth comes in. If they get to 15 to 18 months and they still don't have any teeth and you're worried about it, it's okay to also schedule a dentist checkup to do an x-ray to see whether the teeth are actually in there. But typically they are. It's usually just a matter of waiting for them. So yeah, there's a big variety in number of teeth at this age, anywhere from, I'd say, 6 to 10 teeth down to 0 is still normal. For peeing and pooping, if you are doing potty training, you can do that now. You can have started at 9 months as well, and it's okay to continue with that. If you haven't started yet, you can start off by letting your baby sit on the potty a couple of times during the day. If they're really resistant to it, then let them sit with their clothes on and go in their diaper still, and that's fine. Or you can start letting them sit on it, then you can maybe just take the pants off and keep the diaper on, and then let them sit without the diaper on it and see if anything comes out. For timing wise, I suggest doing it after they eat. Every time after a meal, your intestines move and it makes you want to go to the bathroom. So that's a good natural time to try to catch those pees and poops. And then also as soon as they wake up. Usually they have to pee or poop when they wake up. It's totally okay to wait on potty training if you would like to. I know the average age in the US is between 2 and 4 years that we start with potty training, but you can absolutely start it at a year of age. And they don't necessarily have to be walking to the potty themselves yet. It's okay just to sit them on the potty yourself after those times of, after eating and waking, and see if anything comes out. Usually they're peeing about 6 times a day at this age and pooping at about once or twice per day. And if your baby is constipated, the first step is to increase water and then increase fiber, so fruit and veggies next. And then if those aren't enough, then you can consider some prune juice or pear juice, 2 ounces of straight prune or pear juice once or twice a day. And you don't want to mix that with water because we want it to kind of irritate the gut and cause them to poop. And if that's still not enough, talk to your doctor. They're likely going to suggest Miralax, which is a very safe treatment for babies. Miralax is kind of like those Orbeez gel beads. It just, like on a powdered level, it soaks up some water in the intestines and it makes the poops bigger and fluffier. But you do need to be giving extra water when you're doing Miralax, because otherwise it'll just dehydrate the baby. It'll just keep pulling water into the intestines that they then poop out. So make sure you're doing lots and lots of water. So that's why water is the very first step for constipation. For skincare, just be bathing them as often as they get dirty, which, at a toddler age can be every day. They seem to always be sticky at this age. They're just fine. It's normal. So yeah, just wash them whenever they're dirty. If they're not dirty every day, you don't have to wash them every day. It's okay to use lotions. A lot of them don't need it at this age. But do use sunblock if they're going to be outside more than half an hour during the day. And you can use insect repellent, but make sure it's one that is safe for babies. I like the citronella-based ones the best. The ones that have DEET in them, DEET is pretty toxic, so it's not great for children. But citronella is fairly safe. They should not be eating it, so you don't want to get it like on their hands if they're putting their hands in their mouth. But you can spray it on their clothes. You can spray it on their stroller or wherever they're in, around them, and that can help protect them from mosquito bites. For safety, your house should be child-proofed now, so make sure you have outlet covers, stairway gates. You can get those clips that keep the toilet seat closed because babies can open toilets and fall in headfirst and drown. The best way to baby-proof a bathroom is to keep the door closed and keep them out of that room. Put barriers around space heaters. Make sure your cleaning products are locked away or up really high where they can't reach them. Make sure electrical cords are out of reach because they like to pull on those. If you have a pool, make sure you have a gate around the pool. Drowning is something that happens silently a lot of the times. Babies can fall in and drown within 30 seconds. They're gone. So, and usually there's not a lot of flailing or splashing. They don't understand that they can't breathe in water, and they just take a deep breath of, inside the water, and the water goes in their lungs and they drown. Yeah, be especially careful around water at this age. Also, don't take medicines in front of your baby at this age. So your 1-year-old is going to watch every single thing that you do and try to copy everything that you do. And if they see you open a prescription bottle or even an over-the-counter medicine and put that stuff into your mouth, they're like, oh, that's what you're supposed to do when you get that stuff. So if they happen to get their hands on a bottle, they will try to open it and put the stuff in their mouth. So if you need to take pills around your baby, turn away from them. Don't let them see you opening the bottle or putting them into your mouth and then, drinking the water afterwards. Make sure you keep your baby in arms or in a playpen or in a high chair when they're in the kitchen. And when you're in the bathroom, a lot of babies will want to stay in there with you while you're in there. So, they don't like to be apart from you for too long, but make sure that you have eyes on them the entire time. Even, when you're washing your hands, keep looking at them to make sure they're not falling into the toilet or turning on the water because they can get burned from the shower or bath water, or they can drown in a bathtub as well. You want to set your water temperature to 120 degrees Fahrenheit or less. And that's because at 120 degrees is where if a baby touches that water, they can pull their hand out before getting a scald burn. If it's higher than that, their skin will burn faster than they're able to react to it. So 120 degrees is the cutoff for that. Make sure you're avoiding secondhand smoke. And also remember that if babies see people smoking and they happen to find a cigarette butt on the ground, they will put it in their mouth because they see, oh, those things go in mouths. So don't smoke around your baby. Don't let them see you doing it if you are smoking. And if you are smoking, make sure you do it outside and then wash your hands and change your clothes before playing with your baby. If anybody smells like smoke and they come around your baby, it means your baby is getting those secondhand smoke particles in their lungs. It can affect them. It can cause things like allergies, asthma, and upper respiratory infections. And so definitely try not to let your baby be exposed to any smoke. They should be in a rear-facing car seat until age 2 or until they outgrow that car seat. So as long as your baby fits weight-wise and height-wise in the car seat that's rear-facing, I'd say keep them in it. If you can keep them in it past age 2, it's still safer. Toddlers have really big heads and relatively weak necks. And so they get whiplash real easily if you step on the brakes when they're facing forward. Whereas when they're backwards, their head is cushioned by the seat. So if you step on the brakes, their head just kind of goes into the seat and it's fine, it's safe. Make sure you're not leaving any heavy objects or hot liquids on tablecloths or the coffee table because they will try to pull those over. They will try to grab at your coffee cup and take drinks out of it. So if you have hot liquids, keep them out of reach of baby, like up high on the counter. And make sure you have the poison control number saved in your cell phone, just in case, if you see your baby with a bottle of something, a tube, whatever, that you think, oh, that could have been poisonous, you can always call poison control and they know exactly what to do. Also, if you have any guns in the house, make sure that you keep them locked away and unloaded in a safe because babies at this age will pick up a gun and will point it at somebody and squeeze the trigger. They see it once and they know that that's what you're supposed to do with it. So if you can get the guns out of the house, that's the safest. But if they're in the house, keep them locked away and unloaded so that your baby doesn't accidentally shoot somebody, also including themselves. All right, so for the 12-month checkup, usually they're able to sit alone on the table at this age, which is an exciting milestone for me. But yeah, make sure you're still staying really close to them, like within arm's reach or what's called touch supervision, so that if you just reached out, you could touch them because they do sometimes fall off those tables. And there's always a hard floor right down there. We're going to do a full head-to-toe exam at this age, and we will do vaccines at this visit and the next 2 visits. So the next 2 visits are going to be 15 and 18 months. And between the 12, 15, and 18-month visit, we give a total of 5 to 7 vaccines, plus flu and COVID vaccines. So that's a total of 7 to 9, depending on whether your office does combo vaccines or not. The combo vaccines do tend to have a higher risk of causing a high fever, but also it's one less needle. So it's just sort of a personal preference. And the 12, 15, and 18-month vaccines are variable. So typically we will start hepatitis A at a year so that we can give the second dose at 18 months. Sometimes they'll do it at 15 months and then 2 years of age. So it sort of depends on the office. But they should get 2 doses of hepatitis A vaccine. They're going to get a booster of DTaP and a booster of Hib over the next 3 visits. They're going to get a booster of the PCV or pneumococcal vaccine. And they're going to get their flu vaccine and their COVID vaccines. And then the other 2 new ones are the MMR, which is measles, mumps, and rubella, and the chickenpox vaccine. And it'll be 1 dose of each of those. And there is a combo MMR chickenpox vaccine available, but that's the one that has a higher risk of causing a high fever and potentially a febrile seizure. So if you have any family history of adverse reactions to vaccines, I usually recommend doing those 2 separately. But yeah, the risk of getting a high fever with those 2, because they are live, MMR and chickenpox are both live vaccines. about 1 in 2,500 babies will get a high fever if we give those separately, and about 1 in 1,250, so about twice as likely, but still very unlikely, will get a high fever if we give them in combination. So yeah, their next checkup is going to be at 15 months of age. And just remember that this is the time to have their first dentist visit and also their first eye exam at an ophthalmologist if anyone in the family wears glasses. I hope you enjoyed this episode, and I look forward to seeing you again in 2 weeks when we talk about the 15-month visit. If you'd like to connect with me on social media, I'm on TikTok, Facebook, Instagram, YouTube. Just look for Doctor at Your Door. Thanks, and have a great day. Thank you for listening to the Baby Manual podcast. Please hit that subscribe button below so you don't miss the new episodes when they come out. I would also love it if you could leave me a review. If you'd like to buy a copy of the Baby Manual, it's on Amazon and Kindle. I'm the author, Dr. Carole Keim, and that's spelled Keim. You can also follow me on YouTube, TikTok, Instagram, or Facebook to get some quick baby tips that will make you feel like an expert. Thanks for listening.